Okay, so it's what we wish for, and then our reality, which is that there is conflict in our world. And so I hope that today we would like to invite you to consider conflict a little bit differently as a way to improve your connection and understanding with each other rather than a source of division. So we have a few goals after this introductory workshop, and I stress introductory because we only have, lunch break to spend with you guys. We would like for you to leave with the ability to identify the difference between positions and interests in conflict, to also be able to describe and hopefully start utilizing the communication skills of perspective taking and responding with empathy. And as I stated, we realize this is an introductory talk, so think of it as conflict engagement one-on-one. So we hope to give you some tools and terminology and also whet your appetite to dive further into these skills, which definitely take time and energy. So there are some ground rules. Before we get started, we want to establish an environment for sharing. So we'd like for you to consider this online meeting as a space for confidentiality. So any stories shared here need to stay here. We would also like to invite you to actively engage and adopt a learner mentality. So be curious. Gretchen and I are constantly learning, and we hope to learn from you as well. So we also realize that several of you are new to Zoom, to this platform. So to increase our ability to connect, we would like for everybody engaging to keep their videos on as possible, and as we spoke earlier, to mute yourself unless speaking. So please reach out. Oh, I wanted to say one more thing, Gretchen. So please reach out to Sasha via chat box privately if you have any tech issues, since Gretchen and I will not be able to respond to the individual tech issues to the larger group.
So as Martha mentioned, this may be a novel type of webinar for the group because rather than just lecturing for an hour, we're going to be actively engaging and connecting with each other. You're actually going to be paired with a partner who's going to be your teammate, and you'll get to work with that person throughout several breakout sessions in the webinar. And to practice how this type of breakout session is going to work and to help also foster some connection in the group, we're going to do a brief icebreaker exercise. And first, Martha and I are going to demonstrate that right now. So the prompt for our icebreaker exercise is saying your name, your county, and your affiliation with the Alliance, and then also a favorite meal or food that reminds you of home and why. You and your partner will each have 30 seconds max to share, and Martha and I will demo how this goes. So I'll start. My name's Gretchen Fuller. I'm from Travis County, and I am a pediatric emergency medicine physician. And a favorite meal or food that reminds me of home is my father used to make homemade spaghetti sauce, and I can still remember this like huge pot of like steaming, simmering spaghetti sauce, and the scents would like waft through our entire home. And it's a very comforting thought that reminds me of home back in Ohio.
So as Martha VJ shared, I am from Bell County, and I also serve at the state level with TMAA. And a favorite meal, it's more like a food item, are avocados. And the reason for that is I grew up in Florida and had an avocado tree in my backyard. And they were not those little brown bumpy ones that you find here in Texas. They were like the big green ones, smooth skin ones. And so anytime I see one of those, it reminds me of running around in my backyard and just eating avocados. My parents were perfectly okay with eating as many as I wanted to. So that is definitely a food that reminds me of home.
Awesome, Martha. So now it is y'all's turn. You'll find yourself traveling through space and time shortly on Zoom. You don't have to do anything. You're going to answer the same icebreaker questions with a partner. The instructions are going to be posted in the chat box for reference. And you'll get a message reminder at the top of the screen at the 30-second mark to remind you to switch speakers. At the end of 1 minute, you're going to be automatically brought back to the large group session, And I hope that you enjoy your connections. It can take a couple seconds for the breakout groups to go. So here we go. It looks like Sasha's still getting the breakout group set up, so it might be another minute.
They should all be open.
So Sasha, they're in their groups now?
Yes.
Excellent, okay. And I see 2 participants, Anne and Sunshine, that are not in groups.
Yeah, Anne had requested not to be in a group because she said she's working at this time.
Got it.
Sunshine, I'm not sure why she is not joined. It was supposed to automatically place them into those groups.
Okay. Thank you so much, Sasha. How are we on time?
I just put the 30-second warning up. Okay, I'm going to close the rooms now.
Okay.
My participants. Ooh.
There we go.
Welcome back, group, as you're traveling back into our main session. I hope you enjoyed having a connection with your partner. And that is how the breakout groups are going to work for the rest of the sessions. You're going to have 2 more times that you pair with this partner throughout today's session. Good. And again, if everyone can mute their audio again, or Sasha, you can mute for them. Welcome back. We are going to get started talking about conflict engagement. And one of the first basic things to talk about is that there are many different ways to approach a conflict. You might have heard some of these terms that describe the styles of conflict engagement, such as avoidance, accommodating, competing, compromising, or collaborating. And the reality is that the different approach that's appropriate for the conflict at hand depends on the value that you have for the relationship and also the value that you have for the issue at hand. There's a difference, for example, how you would go about negotiating the price of a car versus how you would engage with others if you're starting a new program or project where you work or volunteer, or if you're arranging a family reunion. And the skills that we're practicing today, I just want to highlight, are really in this upper quadrant, arguably the most complicated type of conflict you can have, when you care about the person and you care about the issue at hand. And we acknowledge, though, that there's times and places for using other styles. We're focusing on collaboration today. And one important note is we often accidentally undervalue the importance of the relationship and don't realize how people are going to come back into our lives later and in what capacity. Martha actually has a great example of how we tend to undervalue that relationship.
Yeah, so as Gretchen and I were preparing for this talk, a quick story that popped in my mind about the importance of being relationship focused, even with those you don't think you'll ever meet again, was several years ago. Before online shopping, I had ordered new glasses and contacts, and the store called me to pick them up. And once I was there, I learned the contacts were the wrong prescription. So a new order was placed, and then I had to wait the necessary weeks, and then I returned, and guess what? This prescription was also wrong. So really frustrating, right? So through the multiple calls and visits, I really got to know the manager because he had now taken care of my order. So fast forward 8 months later, I'm at a friend's 4th of July party, and lo and behold, my dear friend is also close friends with the manager. So how awkward would it have been, those introductions would have been, if I had not been relationship focused.
That is a great example of conflict. And now actually we're going to turn to the audience. We'd love to hear from one of you thinking about a conflict that you have had or in the past or currently have, in which you both value the relationship highly and the issue matters a lot to you. That is to say, it's a conflict for which the best approach is going to be a collaboration style. And if any of you can think of a conflict that fits that bill, we're going to ask that you keep your story describing this to about 30, 40 seconds max, just the details of who is involved in the conflict and what is the issue at hand, not getting into how or even if the conflict was approached or solved. And so if one of you has a conflict that you can think of that might be on the top of your mind right now, you can raise your hand. And at that point, we might ask you to unmute.
Okay, we have raised hands from Lori Urso, Lisa Kurlt, and Jessica Halls. Lori, if you want to go ahead and unmute yourself.
Okay. Well, mine is, I'm sure, pretty common, but my conflict is with my brother, my one and only brother, and it's over politics. And we both care very much about each other and about our various sides of the, what our political bent. So, but it's not enough to ruin the relationship over it.
That's a really tricky situation to be in. And I'm sure is something that you see your brother and are going to be having to talk about this. So thank you so much for sharing that. We just also, if you guys can open your chat boxes, which are, depending on what version of Zoom you have, it might be at the top of your screen or the bottom of the screen, it says chat. And we're curious to get a read from the group. What is your gut instinct or feeling if you have a conflict that you need to address with someone, and you just use one word or phrase? What comes to mind? What's the feeling that you feel if you have a conflict and it's weighing on your mind and you have to address it? What's one word or phrase that you might use to describe how you feel?
I see a lot of anxious and dread and ughs and visceral, stressful, more anxious. Yeah, definitely a lot of dread and not so positive feelings around conflict. So let me ask just a rhetorical question. What do you think is the difference between a regular conversation and one that is described as hard or conflict? It is in part the emotion we attach to that encounter. This is one of the reasons why it may feel easier to offer advice to our friends and family experiencing their own conflict about, and we can easily say what they should have, could have done. It may seem simple for us, and that is because we may not have that heightened emotion attached to the encounter. So we'd like to offer you some skills today to help be able to overcome all these negative sentiments and effectively engage in these conflict type of encounters.
So going back to today's goals, we're going to start at the beginning, which is to identify some basic terminology in conflict engagement. And that's going to be learning what the difference is between something called positions in a conflict versus interest in a conflict. So our position in any conflict is our stance, the line that we're drawing in the sand. It is a basis for debate. Examples of positions include being pro-life or pro-choice, being a Democrat or a Republican. And that is different than our interest in a conflict. Our interest are, on the other hand, our underlying needs, our fears, and our values. And it's these values that give rise to our positions. And these interests serve as a basis for dialogue with another person. And examples of them may include physical safety or feeling valued. You may think back to Maslow's hierarchy of needs when you think about interest. So what's a real life example of this, just to put it to the test? So someone's position might be anti-vaccine, but what might be the underlying interest of this person? Well, the underlying interest may be that they're concerned about the safety of their child, they worry about the harm of drugs, and that they want autonomy in decisions that affect their health. Think about positions and interests like an iceberg. It's a classic 80-20 rule. And we tend to get really hung up on this 20%, the tip of the iceberg, which are these positions. And in fact, under the surface, we actually might share a lot of interest with someone that has a different position than us. If you approach conflict just based on what your positions are, you're really going to have a winner and a loser in a situation. But if you approach a conflict trying to find shared interests, there's more likelihood that you're going to come to a win-win solution, or at the very least, maintain the relationship and keep communication lines and respect open. So this takes two things. There's an element of self-awareness, because you have to be self-aware of your own positions and interests. And then it also is going to take curiosity, because you have to be curious about what the other person's interests and positions were. So for the next bit of time, we're actually going to divvy these up, deconstruct this, and we're going to first focus on the self-awareness piece of what your position and interest are in an argument or conflict. We're going to do that in another paired exercise. And first, we're going to explain the exercise. Martha and I will demo it, and then you'll get to practice it. You'll be paired back with your partner. The first step is you're going to decide on one person to be the storyteller. And that person is going to tell a concise, recent conflict that they've had, or maybe something from the past, no more than 2 minutes to share this conflict. You are only going to really describe the people involved and the issue at hand. And as a listener partner, you're just going to listen, asking no questions, suggesting no fixes to the conflict, not telling any stories of your own. And then in the second 2 minutes of the exercise, you're going to think about the storyteller's what their position is and what their underlying interests might be in this conflict. And it might be helpful to get a pen and paper out and actually make 2 columns, position and interest, so you can kind of keep track of that. First, Martha and I are going to demonstrate this exercise, and Martha's going to be the storyteller and I'm going to be the listener.
So yes, it's a big challenge to tell your story in a short time. So I'm going to try to be super brief. So my 86-year-old uncle was diagnosed with COVID and was hospitalized. And my husband, as most of you know, is an ID physician. And so he offered advice and support, communicating with both the physicians caring for our uncle and our family, our cousins and aunt, which is our uncle's wife. So our uncle was not convinced he should follow the interventions presented by his healthcare team. And you see, this is because he had a friend that was also calling to check on him. And this friend had shared that he had done some research that included a cocktail that was comprised of penicillin and zinc. And he added that you don't hear much about it because they are cheap and doctors and pharmaceutical companies are not going to profit. So this friend, who's not a medical doctor, he's a stockbroker, was also calling the wife, my aunt, and our cousins advocating for this cocktail. And we felt that we needed to have a conversation with this friend.
Wow. So Martha, thanks for sharing that story. And so for everyone listening, that was the first part of this exercise, the storytellers sharing their conflict. And now as a team, we are going to figure out what Martha and her husband's position and interests were in this conflict. So it sounds like giving plasma, convalescent plasma, to your uncle was your line in the sand, the position that you and your husband had. And I'm trying to think about some of your underlying interests, and it sounds like one of them is certainly just like the health of your uncle.
Yeah, so for sure, as we had talked about earlier, one of the things that my husband had offered as taking the role of comparing with the physicians, that as an ID doc, he presented the options, he knew them as he knows them today, and his position, yes, which we all agreed on, included convalescent plasma as soon as possible. And we felt like our interests certainly had to do with the health of our uncle.
And what other interests might you have had?
Well, in addition to the health, we were also worried about the family. We were concerned about just emotionally how the family was feeling, for them to have like a singular message, and how, just providing support, being able to do something, being able to offer value. And, for my husband, he wanted to make sure to contribute his expertise to offer ideas, just as he cares for his own COVID-positive patients as an ID expert.
Got it. So we've added then 2 additional things, which is the underlying interest to help and to add value to a situation. And in the case of your husband, who's an ID expert, to contribute that expertise to a situation.
Yep.
Okay.
That's right.
So now we've demoed that exercise. And Martha, you can take it from here.
Sure. So now that you've seen that demo, one person told a story, and we constructed the position and interests of that conflict. So now it's going to be your turn. So to go through the exercise again, this is an exercise in personal awareness. So we're going to only dive into the storyteller's position and interests. So in a few moments, when you return to your virtual breakout rooms with your previous partner, know that the instructions will be shared in the chat box. And so as the storyteller, whoever you decide that's going to be, your challenge is to be concise. For the storyteller only has 2 minutes to share their conflict. Then as a pair, you will have 2 additional minutes to think through the storyteller's interests and positions, much like Gretchen and I did. And so to be clear, time, only one person will have time to share a conflict in this exercise.
Great. So in a few moments, Sasha is going to have you guys traveling back in time and space with your partner. Thank you, Sasha. And Sunshine, I see that you're not in a room. If you want to unmute, we can chat.
Oh, hello. Sorry.
No worries. It sounds like we were unable to figure out how to add you to a room. Were you hoping to partner with someone?
No, it's probably better because I'm at work, and so I'm in and out.
Okay, no worries. You can feel free.
But I need this conflict resolution because I deal with angry patients.
Yes.
All day long.
Ditto. Well, hopefully, even without the exercise and just seeing the demos, you'll get the exposure that is helpful.
Yeah, if I pick up one tip, then that's good. Then that helps me. I was really excited about your topic. So
thank you, Sunshine. You can mute yourself and get back to work. I didn't want to interrupt you.
No, it's okay. It's okay.
Sasha, any issues with the breakout groups on the back end?
Nope.
Well, thank you.
Actually, people keep leaving, so then we end up with singles, and then I have to shift them like halfway, like someone left in the middle of.
Someone left in the middle of the meeting?
Yeah, someone left in the middle of the breakout. So now,
yeah,
this is the tricky thing.
Yeah.
Like I can't dump them into another room.
Right.
I
can mention when people come back that if it happens that someone has dropped off the meeting, we're just going to be pairing them in other groups, so that they can be a third person as acting as a listener.
Yeah.
Does that sound okay?
Sure.
Just to give them a heads up that that's happened.
Yeah.
And can you see how many people we have in the meeting right now?
Oh, let me see. How many people? $26, I think.
Oh, perfect. And then Martha's paired with someone.
She is, yeah. Okay, I'm about to send the. Okay, I just sent the 2-minute warning, so I set a 2-minute timer.
And I actually can't see where we are in our agenda. I know we started a bit late, but where were we supposed to be at this point when, at the point when people are in this first breakout exercise time-wise?
Let's see. Perspective taking with ICE plus demo. So we're about 10 minutes
behind,
maybe. Yeah.
Okay.
I have about a minute left.
I can definitely shore up the end of the talk quickly.
Okay.
What's up?
Someone in one of the breakout rooms asked for help, and it gives me the option to join it, but it's like I can't join it and manage the other ones, and I'm about to close them, so there's just not adequate time for that.
Yep. How many issues did you have with?
Just the one.
Okay, so the majority were okay.
Yeah.
I'll explain that as soon as we come back.
Okay.
All right, team, welcome back. And if you could remute your audios.
Okay.
And for people just joining back, if you can remute your audios. And I just want to acknowledge that if anyone left the meeting and you lost your pair, we're going to add you as a threesome so that you still have a group to work with. So coming back from this exercise, I just want to acknowledge that we don't always take the time to deconstruct our conflict encounters. So I hope that exercise offered you a framework to discover what your underlying 80% was, and otherwise you're the bottom of your iceberg, because it's really this bottom of the iceberg, your interests, that are crucial to determine what is driving your emotions in a conflict. And Now we're going to turn our attention to the other person in the conflict. And for this, we need curiosity.
Yes, so when we're in a high stakes conflict, we may feel like we're fighting fires. So I want you to actually think that in part our brain, our limbic system is getting fired up. So we often revert to fight or flight, and this is what we call limbic hijacking. So we tend to either give up, give in, or even avoid. So like firefighters, how they train themselves to approach fires, we also have to train ourselves to react differently when there is conflict involving issues and people that matter most. So, armed with skills instead of firefighting gear, I'd like for you to consider these skills as a way to feel equipped and confident when intentionally approaching a conflict fire.
And the tools that we're going to talk about next are a means of igniting curiosity and activating our ability to listen at the time when we're least wanting to do just that. And it's curiosity and listening that are actually going to change the dynamic when we feel stuck in a conflict. It does take some real-time intentionality, and just like running towards a fire, this does not come naturally and takes practice.
So we keep using the word curious. Curious is key. So adopting a curious attitude, here are some questions to ask that can help you determine the other person's interest in establishing common ground, or perspectives you may not have even considered, or can help you discover what you actually have in common instead of focusing on what you do not share or have in common. So what we use, the mnemonic is ICE, which stands for ideas, or impact, concerns, and expectations. So just think ICE in terms of like how water extinguishes fires, it can extinguish a flame. So for the I, it could sound like, how has this been affecting you? Or I'm curious, tell me more about your thoughts regarding X. For C, concerns, what worries you about X? And for expectations, asking, what are you hoping for? Or, what are you hoping to get out of this? Or how do you see this, being resolved? Or what would this look like for you?
So now we're going to go back into our paired exercise for another breakout group. And Martha's going to explain this a bit.
Yep. So just like last time, in a few minutes, you'll be transported back to your group. And so this time, instead of the storyteller speaking, the listener from the previous breakout session will summarize the conflict. And next, that same person, the original listener, will come up with 2 or 3 ICE questions they could ask, and asking the storyteller. And then the reason why we're having the listener do this at this point is because the listener may be better able to do it because they're less emotionally charged from the story. So as the listener from the previous breakout session comes up with the ICE questions, the original storyteller, I'd invite you to hypothesize out loud what that other person's responses might be. And then finally, as a team, work together to list what you believe the other's position and interests might be. So Gretchen and I will demonstrate this.
Got it. So step 1 of the exercise, I was the original listener. So summarizing the conflict that Martha had stated, she and her husband are in conflict with their uncle's friend. And this is because her husband is an infectious disease doctor, her uncle has COVID, and Martha and her husband are advocating for the use of convalescent plasma for the uncle. But there's a family friend who's not a medical professional that is advocating a different cocktail of medications and sharing this idea with the uncle and other family members. So there's a conflict that needs to be addressed. So that's the summary. Going to step 2 of the exercise, I need to come up with some ICE questions that Martha and her husband might be able to ask their family friend to get at the family friend's underlying interests, his underlying values. So here are some ICE questions that I might be able to ask. So Martha, as I go through these, you can tell me how you think your family friend might respond if you ask them. For an impact or ideas question, you could ask your family friend, so how has your friend's illness been affecting or impacting you?
So family's friend may say, it's been awful. I'm scared. No one can go see him. He's alone. He's my friend. Yeah.
And, oh yeah, and for concerns, what if you asked your family friend, what worries do you have right now about his condition?
No, he'd say, like, he sounds worse. We're feeling helpless. We got to do something. Yeah.
And what if you asked your family friend, what outcome are you hoping for from the cocktail of medications that you're recommending?
So I'd imagine he'd say something like, I've been doing a lot of research and I've been reading and watching a lot of videos about the virus, and I think it can't hurt and it could possibly help.
Got it. So at this point, we've done steps 1 and 2 of the exercise, and we're going to move on to step 3 again, where we create that position and interest chart. And it sounds like, Martha, that the position of your family friend is pretty clear. They want to utilize the cocktail of medications. And then hearing your responses to those ICE questions, it sounds like the underlying interest of this family friend may actually have a lot in common with you guys, but he probably is concerned about the health of his friend. He probably wants to protect his loved one. You mentioned like you hypothesized that he wants to like do something, so he wants to advocate by action. And then he's done some research, and he probably wants to share that.
Absolutely.
So at this point, that is the demonstration of the exercise. The instructions are going to be posted in the chat box. And again, you're going to have 6 minutes total for this exercise. 1 minute to summarize the conflict, 3 minutes to come up with ICE questions and the responses, and then another 2 minutes to do your positions and interest chart. And there will be prompts at each of the time points telling you when to switch tasks. And again, if there's anyone that's dropped out of your meeting, then you don't have a partner, you're going to be just paired with another triad. And we'll meet you back on the flip side. Sasha, any issues this time?
None yet.
Okay.
I'm pasting the instructions in. Okay.
And you pasted the ICE stuff?
Yeah.
Cool, thank you. And how far are we behind now?
12:44. Oh, it's still about 10 minutes, really.
Okay. I think I've given us about 5 minutes to wrap up that we don't need, and then we can shorten up pearls.
Okay. No, we're not too far behind. Okay.
How much time do they have left now?
About 3.5 minutes.
Okay. Sasha, can you see if a participant Nikki Bright is still on?
I don't see her anymore, no.
Got it. Okay, she dropped
I
out.
did see her earlier.
Yeah. And they must be getting down to the end, right?
They have 1minute and 20 seconds left. This is the final breakout, right?
Yeah, this is the last one. No more breakouts.
Okay.
Gonna wrap.
Okay.
There's like one more educational topic and then we say goodbye.
Great. 45 seconds left.
Perfect.
Okay.
So welcome back. I hope everyone was able to get their stories and positions and interests out. I know it's a little truncated in this space. Wish we could have been face-to-face and can kind of get better view of what people are up to. So you asked some questions and you got some answers, and the next step when you ask ICE questions from the other person is to respond with authentic empathy. And empathy is crucial to extinguishing the fire. If the other person doesn't get the sense you truly care about their perspective, it is going to be so much harder to resolve that conflict. So there are a few ways to respond with empathy, and I think most of you are familiar with the nonverbals, like pause, touch, or your facial expression, or tone of voice, face. Unfortunately, with social distancing and mask wearing, some of these nonverbal attempts at conveying empathy may be obscured. So here's something to share with your clinical spouses tonight. A lot of our physician spouses are also sharing this same concern of not being able to express empathy with masks. Um, here are some other ways. So verbal empathies, we call these pearls. And the pearls stand for partnership, emotion, apology, respect, legitimization, and support. So partnership might sound like let's work together too. Emotion, I imagine this is frustrating for you, or I can see how how this is making you sad. An apology is I made a mistake, I'm sorry, or please forgive me. Respect is I respect your honesty, or another one might be it's like I give you a lot of credit for the effort that you've made. Legitimization is most people might feel the same way in your situation, and of course support is would X this would this or that be helpful for you. So explicitly addressing empathy with pearl statements, for example, naming an emotion that the other person is conveying, like sadness or frustration, can be incredibly effective in conflict management. When you're listening to the other person's perspective with, utilizing the ICE questions, you will be most successful if you incorporate empathy and these pearls in your responses. So we all have our favorite pearls. We all have our favorite go-to phrases to express empathy. And so the goal of these pearls, these 6 options, is to broaden your repertoire, to expand your toolbox, and find phrases that authentically work for you and will also meet the needs of the relationship. So these six different ways to express empathy. So if you notice that your empathic statement is not landing appropriately, just think you have 5 more to try. So it is really important for you to find your own words and phrasing so your statements come across as authentic and not canned. And I would strongly encourage you to pick 1 or 2 that are not your go-to and really work out that empathy muscle. And one last thing I want to say about empathy is if you've ever been in a conversation where the person is repeating themselves and you think, I know, yeah, I heard you already, you said that, that is usually, like when that happens to me, that's usually a sign that I have not responded with empathy. That's why that person keeps repeating themselves.
So that was a great summary of that, Martha. Thinking about our example and how to put this into practice, let's think about the ICE question that we asked Martha's family friend. We said, how has your friend's illness been affecting you? And we hypothesized that the friend may have responded, it's been awful, I'm scared for him, and no one can go see him in the hospital. So an example of 2 pearls that you could respond to this family friend with in that moment are 1, an emotional statement, E, I'm hearing that you're frightened about his health. Another example would be legitimization. I think many friends and family of his are probably feeling just the same way as you right now. And that's an example of how you might incorporate that into practice.
So today we've covered basic terminology and tools to help deconstruct a conflict and have just started to hone in on some of the skills that can help you resolve conflict. So we hope practicing some of these skills can reduce your angst about gaining more experience in navigating these types of encounters. So before we end our time, we would like to hear from you to get your perspective. So what is one concept or skill that you will take away from today's webinar to implement in conflict in your life? Please share in the chat box, and we will pause a little bit for your answers. using ICE questions, legitimization statements, remove my emotions and really focus on the ICE questions and pearls, listen and ask questions. For sure, taking an attitude of being curious instead of like being upset or have, certainly our buttons get pushed, but immediately focusing on, let me be curious about this encounter, about this situation. Asking questions to find out more about their perspective, absolutely, for sure. So a huge thank you. Gretchen and I want to offer a huge thank you. Pam, for conceptualizing and inviting us to do this. I'm really glad to be able to share part of my life, as I stated earlier. Sasha, our technical guru, as most of you know her to be. And the Academy of Communication and Healthcare has tons and tons of information. You don't have to be a member. You can go to their website and find additional, lots of free stuff for your physician spouses. So thank you for hosting us, and would like to open up and to hear what questions you might have.
We did receive a request to see the iceberg slide one more time.
Oh,
Sure.
yeah. I can go back to that in just a moment. Also, on this slide, we'll come back to it, but you'll see our contact information. And if you have any follow-up questions or want to debrief your own conflict exercises that you worked on, we're happy to do that offline with you. And we'll come back to this slide so you can see it. Let me just get back to the iceberg slide again. We'll put it on this for another couple seconds.
And Gretchen, will we be able to share these this slide presentation with them afterwards?
Sure, we can do that. It will be a PDF.
Great.
Yep,
thank you.
We can certainly do that. And I know that one of the questions that we will have in our, post enrichment series survey is interest to dive deeper into these skills. And so when we do that and take a little more time, we will certainly offer additional materials and resources.
And speaking of that, you will each get a follow-up survey after this. And given that this is like a new type of way of doing a lunchtime webinar, we'd love to get your feedback on what you thought went well, what you'd want to do differently, any issues with breakout groups that we could address. And there will also be a question asking if you're interested in kind of like the next step beyond the conflict 101, beyond these kind of more basic terminology kind of concepts, and getting into some things like making a request of the other person. So if you're interested in that, just indicate that on your survey. And we hope that you each have a wonderful day. And I'll be on for a bit more if there's any other questions as well.
Thank you. And everyone will receive this survey later this afternoon. So please take a few moments to give us some feedback. And thank you for kind of acting as our guinea pigs with these breakout rooms. This was kind of a unique session, and hopefully, I think for the most part, hopefully it went well, but please do share any feedback about that in this survey so we know how we can improve later on.
Well, I think you did a great job.
Yeah, thank you.
Thank you, everybody. I just want to remind everybody that this will be available on replay at textmetalines.org, so we can go through the session again. I found it very valuable. Thank you, Gretchen, Dr. Gretchen and Martha, for just being so fabulous. But we do want you to fill out the survey, so please be looking for that in your emails. And we want your feedback, because we always are trying to improve these webinars, because these are for you. We want to make sure that we get, if you have any topics or anything that you have of interest, please let myself or Pam or Sasha know, because we are looking through the end of the year or all the way through next May to continue this. Our next one is going to be October the 15th. It's called COVID-19, What Do We Know Now and Where Are We Going? And it's going to be presented by Dr. Valerie Smith. She's actually the one that presented our very first webinar, and she's going to give us the update. of where we are with the pandemic across Texas, what to expect since schools have reopened, new testing options, what's about the vaccines on the horizon, and much, much more. You can learn about the progress made toward preventing COVID and how families can work together to further decrease the spread. Dr. Valerie Smith is a Tyler pediatrician, and like I said, she was our first webinar series speaker and did a fabulous job then. She's part of the TMAA COVID task force, and she's also on the Return to School Work Group chair, and she also is on the subcommittee on behavioral health. So please go register at textmedalliance.org for this one. While you are there, please go register for our mini regional conference. That's going to be October 2nd. That's just right around the corner. We have 3 great educational programs, and they are free. And so they're available to all TMAA members. And it's going to be a great little mini conference. And so we hope to see you there. That'll be October 2nd coming up. And also it's membership renewal time. If you have not renewed your membership, while you're at the textmedalliance.org, it'd be a great time to renew your membership as well. But thank you again for today, ladies and gentlemen. I appreciate all of you being here. Thank you for your participation with the breakout groups, and I think it went very well, and we will have more breakout groups in the future. So everybody have a great day and a great rest of the week. Thank you again, you guys. Amazing job.